Good day. I'm Nurse Jer Cabra from Australian University, Philippines. The fourth procedure is the postpartum maternal physical assessment. Before I discuss the procedure, I need to discuss first the purpose. The purpose is to fully assess a postpartum mother, preventing complications after the delivery. Second is the assessment. Assess for the following: client's level of consciousness and ability to follow instructions, methods and dates of the delivery, numbers of postpartum days, and the vital signs of the mother. Third is planning. First plan is to fully assess, educate, and validate the knowledge of a postpartum mother care. Second plan is initiate nursing interventions for abnormal findings and document findings. The third plan is the gathering of all materials: bed, pillow, top linen, stethoscope, BP apparatus, pair of clean gloves, and thermometer. So now I'm going to perform the procedure.
Identify the correct patient. Make sure you use the two patient identifier, which is the name and the birthday, and it's sometimes stated by the patient. Introduce yourself and state the purpose of the intervention. Hi, I'm Nurse Jericho and I will be your nurse from 6 a.m. to 2 p.m. The doctor's order is to perform the postpartum maternal physical assessment to fully assess a postpartum mother, thereby preventing complications after delivery. Provide privacy for the patient. Set the bed to a comfortable height to work and lower the side rails where you will work. Before touching the patient, make sure you perform the hand washing. Check the patient's vital sign and record, which is the BP, pulse rate, respiratory rate, and temperature. Wear a pair of clean gloves before performing the following assessment. Performing breast assessment. Position the client in a supine or sitting position. Open the gown, exposing the breast to be examined. Inspect for the following: consistency, nipple type and integrity, swelling, redness, engorgement, and tenderness. Tie the gown after the procedure. The second procedure is the uterine assessment. Expose the client's abdomen, covering the upper part and the lower extremities. Assess the tone, height, and location of the pondus. First, immediately after birth at the level of the umbilicus. Second, 1 to 2 hours after the delivery, midway between umbilicus and symphysis pubis. Third is 12 hours after the delivery, 1 cm or 1 finger breadth above the umbilicus. Fourth is 24 hours after the delivery, 1 cm or 1 finger breadth below the umbilicus. Fifth is the 48 hours after delivery, 2 cm or 2 finger breadth above the umbilicus. Sixth, 72 hours after the delivery, 3 cm or 3 finger breadth above the umbilicus. The third assessment is the bowel assessment. Ask the client whether she moves her bowel or not, or whether flatus is positive or not. Auscultate for the bowel sounds. Assess for abdominal distension. The fourth procedure is the bladder assessment. Ask the client for the voiding pattern, presence of pain or burning sensation during urination. Palpate for the bladder distension, and track fluid balance intake and output. The fifth procedure is the lochia assessment. Assess the amount of lochia. Note time of last perineal pad change. Note for the amount of lochia on perineal pad, either scant, small, moderate, or large. If weighing perineal pads, 1 gram is equals to 1 ml of blood loss. Assess the number of days the woman has delivered her baby. The type of lochia or vaginal bleeding is on this. There are different types of lochia. The lochia rubra is 1 to 3 days, blood is red in color. The lochia serosa is 4 to 10 days, vaginal discharges are brownish pink in color. Lochia alba is 11 to 21 days, vaginal discharge are yellow to white in color. Document the number and size of blood clots. Turn the patient to assess for blood loss under buttocks. Remove the medical gloves and perform hand hygiene. The sixth procedure is the episiotomy or episotherapy assessment. Wear sterile gloves. Place the patient in lateral position with her back facing you. Expose the client's buttocks. Inspect for the following: redness, edema, ecchymosis, number of stitches, consistency of discharge, and approximated edges. Palpate the edges of the stitches using either of your thumb or index finger, noting for the presence of discharges from the stitches and pain upon palpation. Dispose or arrange used materials properly. Do hand washing. Record all data in the client's chart. Refer any abnormal findings to the attending physician.